Hello, Joan Comrie here. Today we're going to discuss the question of when should my child be self-feeding. That's a question a lot of parents ask me. And they should start self-feeding about 8 months when they use kind of a rake, which basically means that they kind of grab the food with their hands like this, and a lot of times they get an entire fistful of food as they're trying to shove it into their mouth. The positive thing is they're not very good at that coordination and most of the food falls out, which is good so that they're not going to be choking on it. At about 9 months of age, they're using that pincer. That's the little finger grasp, and that's why it's really, really important. We talked about how big should the food be that we serve our children, and that's when I talked about it should be about the size of your pinky nail. And that's the perfect size for them to pick that food up and place it to their mouth. Now, one way to encourage that skill over the raking skill, which is less mature, is by putting one piece of food on their tray or on the table, wherever they're seated, at a time. And that way, they're gonna be more likely to use that fine pincer movement to pick that food up and place it to their mouth. Now, spoon feeding and using a fork, they should be fairly competent by age 2, but by age 1 and sometimes even younger, I see kids in feeding therapy wanting to feed themselves. And sometimes they need hand over hand. It's really important to put the spoon in with the bottom of that spoon so it can touch the medial tongue. That's a really important sensory thing during feeding that they should be able to tolerate. And what that does as they get older is it helps collect. It's called a cohesive bolus, which basically means your food gets all put together so that when you swallow it in one piece, and there's not scatter all over your mouth and it doesn't go the wrong way. So it's gonna be more likely to transit down your throat into your stomach a lot easier if you have that little cupping of your tongue, which is created by placing a little pressure of the spoon on your tongue when you're feeding. A lot of kids with sensory issues like to flip that spoon, and we can talk about that in another session about what that means. And then also the fork. By age 2, they should be able to spear the fork a little bit and be able to get it to their mouth. And certainly you can always provide hand over hand guidance or put a little weight on their elbow so that it's a little easier for them to pick that fork or spoon up to self-feed. And some things that you can do in the bathtub, you can go to the dollar store or just go to your kitchen and get long-handled cups and work on that twist of the water and dumping it out in the bathtub. So when you scoop that water and you dump it out, that's kind of the wrist movement of spoon feeding. And so those are typical development. You want to be able to do the raking at 8 months, pincer at 9 months, spoon feed and fork feeding by 2 years of age. And typically 1-month-olds are trying to do spoon feeding and fork feeding themselves. So I hope that was helpful. If you have concerns about how your child is feeding, please don't wait. The early intervention is the best. It's so much easier for me to have an 8-month-old that's having issues than to have a 3-year-old or a 1.5-year-old child that's not chewing or not spoon feeding or using a fork. Super, super easier when a child is younger than when they're older. So as soon as you're concerned, find some help. And certainly you can use me as a resource. I also do parent consults. So if you ever want to access that, you can go through my website, feeding.com, and find me, and I'd be happy to help you out. Thanks for your time. Hope you have a great day.